with Dr. Amanda Milstein, who you'll meet during this meeting. This is our first meeting of the crazy new year. Just as, flagging the fact that Amanda and I, and I'm sure many of you, have a lot of life chaos going on right now because of Omicron and all the changes. So lots of grace all around for just kind of rolling with the punches. And we appreciate you making time to be here with us, because we're really excited about this conversation. And there's actually a little bit of nervousness on sharing what we've been putting a lot into in terms of creating our strategic plan. So with that, we'll go to the next slide. And if you want to, in the chat, write your name, pronouns, which I should do too. And then if you know what native land you're on, that would also be fun to include. So we're going to start as a way to just ground ourselves for the next hour in why we're doing this, in a video from a campaign called Science Moms Campaign. We really appreciate their kind of messaging, and this may make you cry, but it illustrates some of what CHN wants to do in terms of messaging. So we'll play this. It's just 1 minute.
Can you guys see that?
I know by the time
Yeah.
she takes her first breath, 9 billion more tons of carbon pollution will be in the air. When she takes her first steps, wildfires will have burned millions more acres she could have explored. The day she gets her first pet, there are thousands of newly extinct species she'll never meet. The night she forgets to call, the night of her first heartbreak. Her future home floods for the first of many times. By the time a child born today goes to college, it may be too late to leave them the world we promised. Our window to act on climate change is like watching them grow up. We blink and we miss it.
So pretty heavy duty and real, right? That's why we're here. So going to the next slide. So just a really brief overview. This hour will be very high yield, lots of ground to cover. And the beginning will be kind of a high level overview of our building our structure to grow really strong and grow our power. But then there's going to be space for you to get to know each other, to share feedback, to ask questions in our breakouts. So we'll spend 20 solid minutes in breakouts that will be around our 4 proposed areas of work. And the invitation is to join the breakout that really interests you the most, because we want to get feedback from you. And we have awesome facilitators in each of those groups. So that'll be a place to get to interact and share more ideas. And then we'll pretty much wrap up after that. So next slide. So teamwork is making this dream work. A big thank you to Karina, who's taking notes, Adrian, who's monitoring chat and kind of bringing in things that we should bring into the conversation and talk about. Margie is going to be our norm champion. Nathan, you are going to have a lot of monitoring to do on timekeeping, because we have a lot to cover. So thank you, Nathan. And Amanda is screen sharing. So thank you all. And then going to our next, the norms. So Margie's gonna help pull these in if we need reminding, but I'm going to just call out the one, number 4 for today, of culture of safety, so that we really, let people share ideas, let there be disagreement of ideas, and it's maybe a given to say, but just really respecting if somebody has different ideas than we do, because this is really a brainstorming kind of a conversation, and so we want to kind of have it be really open for a broad range of ideas. And then next slide. So Amanda, will you take this one?
Yes. Alrighty. Hi everyone. Can you hear me okay?
Yeah.
Okay. Sorry. I always feel like I'm behind a black wall or something when I'm screen sharing. It is lovely to have you all here today. I'm Amanda Milstein. I'm a primary care pediatrician in Richmond, and with Ashley, one of the co-founders of Climate Health Now. And I just want to underscore again what Ashley said at the beginning, how grateful we are that you are all here and how much we know and are living how disrupted and scary everything is right now. And so just having grace and supporting each other, we're just very grateful. So we wanted to just have, I know we have a bunch of new people here who this may be their first monthly meeting. If it is yours, we would ask if you can just raise your hand. Ashley, you'll have to look because I can't actually see people on video.
Sure.
And just share your name, if you're currently in practice, where you practice, what your specialty is, if applicable, and where you live and work.
Yeah. And if you're not speaking, if you could mute yourself, that would be helpful. So yeah, Anita's hand is up.
Hi, everyone. I'm Dr. Anita Gand. I'm in internal medicine, primary care, and actually a recent kind of focus in mental health prescribing as well. And I live in Pleasant Hill and practice at Antioch Health Center, which is part of Contra Costa Health System. So glad to be here. Thank you.
Wonderful. Yeah. And anybody else, if this is your first meeting, Christine James is back after giving birth. Welcome.
Hi, Christine.
Hi, guys.
Maybe welcome. Johnovi, is that how you say your first name? If you want to say hi.
Hi there. My name is Johnovi. I'm internal medicine physician. I work with the Palo Alto Medical Foundation in Los Gatos, and just getting more interested in the pursuit to halt climate change and network with you all. So this is my first meeting. So thanks for having me.
Great. Thanks for joining. Who else is new today?
I'm new. Can you hear me?
Yeah, welcome.
I'm Maria Burrell. I'm from Santa Barbara, and I practice in Ventura County as a family physician and also an administrator for a group of about 30 physicians called Primary Medical Group. And I echo what others said before me, just curious and excited to network and see what we can do to help.
Awesome. Welcome. Diana, have you joined a community meeting before?
I believe so. It's been a little while though. My name's Diana Mokaya. I live in the East Bay. I'm a family doctor and I practice in Santa Cruz.
Great. Wonderful. Anybody else new? First community meeting?
Hi, everybody. I'm new as well. My name is Brenda Nguyen, and I'm an ophthalmologist in Los Angeles. And I also just had a baby, so glad to be back at work and glad to take charge in this realm as well. I'm really excited to be here. Thank you.
Yeah, great. Wonderful. Anybody else? Okay. Well, really glad to have our new folks and those of you who've been before. Thank you for being here. And we're going to move forward. So Amanda, you're going to take the overview slide.
Yes, okay. All right, so here is what we are hoping, and yes, Cynthia, I see you just put in the chat, congrats to the new moms for sure. Here's what we're hoping to run through today in the lead up to the breakout sessions. And this is essentially all around how can we, so very brief framing, CHN has now existed for about 2 years. We, in that span of time, have done a lot, learned a ton, made some mistakes, had some successes, and the question is, where do we go from here? How can we be stronger? How can we be more meaningful internally, among our own community and externally? So we're going to go through some proposals now for our mission, vision, theory of change, what our current leadership and legal structure is, and where we're moving with that. A proposal basically for a statewide membership structuring process. We're going to touch a little bit on fundraising, just sort of, oh, I'm sorry, there's a gray block. I bet that's the chat. Sorry. Is that better, guys?
Yeah.
Okay, I was looking at the chat, sorry. A little bit on fundraising, and then go through an initial proposal for areas of work. And that's where we're going to jump into the breakout sessions. And we're also going to touch briefly on our listening campaign, which you'll learn more about as well. All righty. And this is just a brief trip down memory lane of some photos of our first ever sort of coming together under the Climate Health Now umbrella. And this was in September of 2019 around the Global Youth Climate Strike. All righty, Ashley.
So our mission, which we've worked on a lot, is that Climate Health Now is a group of doctors and nurses and all health professionals in California, across California, who share a recognition that climate change is the public health and equity emergency of our lifetimes. Because of that, we are working to organize and mobilize the trusted voice of health professionals to advocate for a rapid, just transition off harmful fossil fuels towards a healthy, equitable society sustained by renewable energy. Yes. So that's our North Star of what we're trying to accomplish. It's a big one. And the theory of our theory of change for how to accomplish that. And I didn't know I'd never heard the term theory of change before like a year or so ago. So the idea is that this is the theory of how we can use our resources in order to bring about the change that we want to see in the world. So our theory of change is that because doctors and nurses and health professionals are among the most trusted professionals in the US, and research shows that when we talk about climate as a health issue, and particularly the health benefits of climate action, that's the framing of messaging that really helps to boost climate action. So if you talk about, just polar bears, it doesn't boost the kind of social will to vote for a climate action fund as much as if you talk about the air quality improvement of climate action. So because of that, what we're doing is we're organizing our community, using community organizing to leverage our profession's very unique social trust to influence public opinion and to pressure decision makers and policymakers to prioritize the interest of our patients' health and all public health in California over the financial interests of oil and gas. So our theory of change is really leveraging our unique social influence and trust to make climate action something that is not a partisan issue, but a unifying issue. Like we all care about our families. We all care about, healthy, health for all. So that's what we're trying to leverage. And that's our theory of how we can bring about change, is leveraging our voice. Okay, next slide. And so our vision of tomorrow is that every medical professional in California sees climate justice activism as part of our professional duty. We do no harm, and we are active advocates for climate action as a part of being a health professional. And our vision is that the medical community in California is energized by our collective power to shape public decisions and achieve climate justice in order to protect health. And as a result of that engagement, all Californians are surrounded by socioeconomic and environmental determinants of health that achieve health equity in inclusive, vibrant, and regenerative communities in a stable climate. So that's the, utopia that we're spending our evenings and weekends and days trying to achieve. And then the next slide.
Just wanted to mention that this specific wording of the Vision of Tomorrow came out of a collaborative effort that the members of the CHN Catalyst came up with. So though this is all iterative, this is sort of where we got with that statement.
Mm-hmm. And the Catalyst Collective was a 4-month training that many of our participants today, who especially will be leading the breakout groups, we had 18 CHN members participate in this training that was about community organizing and how to, what is community organizing and how can we engage in it as health professionals. So we will be offering more training opportunities like that in the future. So then our policy platform, which is, what do we stand on? What are we for in terms of policies? And because there's so much buy-in and kind of support around the US call to action on human health and equity already, and it's really, broad. The AMA signed on, CMA, like over, I think 150 different groups. This is what we're working with as our policy platform. I'm sure it will evolve and we will iterate, but for now, this is what we're standing on. And just very briefly, because there's a lot of words on here, that we, are for the Paris climate agreements and achieving them to limit warming, that we are for transitioning rapidly away from the use of coal, oil, and gas, which is also called methane, to clean, safe, and renewable energy, that we are for zero carbon transportation systems, and especially active transportation in that transportation sector, that we are for sustainable and resilient farms, that everybody should have access to safe and affordable drinking water. And especially number 6 is really important for California because California is a petro state. We're the 6th largest producer of oil and gas in the country. So we are for a just transition that includes and looks out for the interests of workers and communities as we transition to a low carbon economy. We are for engaging the health sector voice in the call for climate action. We are for climate solutions in healthcare itself and public health systems. For resilient communities, the adaptation side of climate action. And then number 10 is investing in climate and health like divesting from dirty fossil fuels as well. Thank you, Nathan, for the time check. And then next slide, and Amanda's going to give this this one.
Sorry, I was muted. Okay, so I know we're kind of throwing a lot of information out, and we will stop doing that momentarily, but a few kind of structural things that we wanted to talk about that to support all of this and to help make it transparent and meaningful and effective are really about our own internal structure, which is not something that is well defined at this point. So one major component of what we are proposing for the next 6 months or so is to undertake a statewide membership charter, basically, or charter process, in order to really define what does it mean to be a member of CHN, how are decisions made, what is the, et cetera, et cetera. And we actually are just received some funding to use some professional coaches to go through this process. So we'll share more about that, but just to put that out there. We just also officially convened our first external advisory council, which is 7 people, many of whom are in California, but a few of whom are outside of it, with expertise in all sorts of different areas: community organizing, environmental justice, advocacy, communications, physician and health professional advocacy specifically, who are going to start meeting hopefully later this month. And then what we're going to go into detail right now is essentially a proposal or a request basically for feedback on strategic areas of work. Where are we actually going to do to work, and what areas are we going to set goals around?
And in the interest of time,
Yeah.
We're just going to give this overview. So,
Okay.
you know, we're just going to give you a super high level and then create the space for you to talk about it in the breakouts.
Okay. You want me to skip the next few slides?
Yeah, I moved them.
Okay. Thanks. All righty. So here is essentially a proposal for 4 areas of work in which we think, through the experiences we've had over the last 2 years, lots of conversations, that we think that there is meaning and value in our engaging. And well, again, more info to come. But the first is decarbonizing our own healthcare system in California. Essentially, how do we, healthcare in the US contributes 8 to 10% of greenhouse gas emissions. There's, I'm sure as many of you, if not all of you know, there's lots of groups doing at a sort of C-suite level system decarbonization, but there's not a huge clamoring widespread across the state from health professionals themselves to decarbonize. So that's the first proposed area of work. The second is working within our own organized medical societies and associations to essentially agitate for them to become advocates for climate health and equity. So within CMA, within ACCMA for those in Alameda and Contra Costa County, AAP, et cetera, how do we basically leverage the power of those organizations to impact climate health and equity? The third is around messaging and basically being the communicators of the health impacts of climate change and the health co-benefits of climate action. So we hear from so many of you, and also from ourselves, I want to talk about climate change and health, but I don't know where to start. So how can we create a community across California of health professionals that are versed in this, that do know, that have a sense of what is important to communicate and are able to effectively communicate that. And then the fourth area is in what we've called for now strategic partnerships for climate justice. And this is what we really see as our community facing work. The first 3 here, or certainly the first 2 and the third potentially as well, are really internal to the healthcare community, and the fourth is really external facing. So one of the biggest lessons we've learned over the last 2 years is the incredible power that exists within all of our communities and the incredible work that's already being done by groups on the ground, environmental justice groups, community groups. How can we strategically partner at a local level with these groups, basically to uplift the work that they are doing and to bring our trusted health voices to that work to help move it forward? I'll leave it at that.
Yeah.
So this, I think I'm going to skip through.
Exactly, until we get to the fundraising part.
Okay.
Yeah. Beautiful. So just to flag, we are getting ready to resource our mission and our vision. And so, just planting the seed that we'll be working on writing grants, and what we're trying to achieve is staffing this vision so that we can really accomplish it. So that will, for now, what we're seeing that involving is an administrative assistant, and then a full-time community organizing director, and then a part-time operations director role, like middle of this year. And our working numbers are that we're going to be trying to write for grants to raise $225,000, $225,000. But we've done this on a shoestring to date, and so we're trying to get much more sustainable about things, and that will involve fundraising. So just to flag that. And then the next slide. So much gratitude to our facilitators. So we have a really wonderful team of folks who are going to be facilitating and also helping to take notes in the breakouts that we're about to break into. So you all can kind of, again, you're going to choose the breakout room that interests you the most. And this will be a way to get to know each other. We really want you to, take a minute or so each to introduce yourself. Maybe say, why are you spending your lunch hour with us? Why does this matter so much to you? And then just brainstorming, when you think about this, these content areas, what are the areas of work that, here's my why. What are the projects that you think of? And we do welcome devil's advocate kind of thinking. So if somebody says, well, I don't think this really should be a priority, or, we welcome that kind of difference of opinion, because we really want to crowdsource everybody's wisdom and perspectives. So let's see, I think all of our facilitators are all set. Thank you, Teresa, Bill, Mark, Angelina, Meghana, Adrian, Nightingale, and Ode and Vanessa are the team who's going to help make this work. And so Amanda's going to put up the breakouts, and then please just join whichever one calls to you the most. And we're going to spend 20 minutes. So we'll come back at 1:17 from the breakouts, and we'll all have a discussion afterwards too.
Mama. So you should all be able to pick your own room. Are you guys seeing a message that allows you to do that?
It's saying
no.
Please wait to be assigned.
Oh,
They're going to be assigned.
Okay. Let's see. Okay. Could you guys put, I guess, Ashley, what do you think? Let's see. I can see if I can quickly change the settings.
Huge black boxes in this covering our screen.
Does anybody, do you see four little boxes up at the top of your screen? That's, I think if you click on that, that'll help you join the breakout, I think.
So there should be, there's partnership, decarbonizing healthcare, activating organized medicine, and storytelling. Another option, if you can put in the chat where you'd like to go, I can assign you. It's supposed to allow you to assign yourselves, but apparently that's not gonna happen. Okay, Sarah
Screen share has anything to do with it.
Oh, okay. Let's try. That's a really good idea. Okay.
I'm not saying that will work, but
no, yeah. Well, let's try. Did that work?
No.
No.
Nope.
Okay. Well, yeah.
Wait
to be assigned. Okay, so if you can pop into the chat where you want to be assigned, and Ashley, I'm going to make you, oh, you are a co-host. Okay, if you can help me assign people. So let's try this. I'm sorry, guys. You'd think 2 years into Zoom, we'd have it down.
Yeah, I can, if you can see, I'm sure some of you might be able to see the join breakout room. It could be,
it's my screen shows the Eventbrite, and so it's not normal Zoom.
Oh.
So
okay.
and I had to join through Eventbrite, so it's not like looking like Zoom usually looks.
See. Okay, gotcha. Thanks.
Eventbrite, not good.
Oh, Eventbrite was not good. I thought it might be better because, okay, good to know. Good to know.
And then I thought I saw a fourth category about strategizing, but it was covered with like black squares.
Oh, okay. Strategic partnerships, was that it?
I think so.
Okay, is that where you want to go, Bonnie?
You didn't mention it though. So, okay. So you want to say the four again?
Yes. Okay, so the four.
Amanda, if you could help pop people in, because I'm not able.
Okay.
So the four areas that we are proposing for our strategic plan. So organized medicine, decarbonizing healthcare, strategic partnerships for climate justice, where we play more of a supportive role with community and environmental justice groups. And the other one is storytelling for climate action. So health professionals really telling that narrative of why climate action is essential for health. Yeah, storytelling, organized medicine, decarbonizing healthcare, and strategic partnerships with community and environmental justice groups. Thank you all for your patience. Damn Zoom.
Guys, can I try a different approach? I'm going to say someone's name, and can you tell me where you want to go? Adrian Van.
I'll go to storytelling.
Okay. Javier Sanchez.
Organized medicine.
Organized medicine. Got it. Okay. Cynthia Mahoney. Storytelling. Got it. Okay. Brenda.
Sorry, decarbonizing.
Decarbonizing. Okay. Todd.
Organized medicine, please.
Organized. I feel like this is a game show. Sarah May, you had said organized medicine. Okay. Nightingale.
Storytelling.
Storytelling. Got it. Okay. Susan.
Strategic partnerships, please.
Okay. Partnerships.
And Mark's in decarbonizing healthcare.
Nathan.
Decarbonizing.
Decarbonizing. Okay. Bonnie, did you say strategic partnerships?
Yes, thank you.
Okay. Okay. Karen Duderstadt.
Strategic partnerships.
Got it. Okay. Megan.
Can I go to organized medicine, please?
Yes. Okay. David.
Decarbonizing.
Eve.
A strategic partnership.
Okay. Maria.
Decarbonizing.
Decarbonizing. Cynthia Carmichael.
Strategic partnerships.
Yeah.
I got it. Okay. Tell me when. Well, you can start, Ash, whenever.
Welcome back from the wormholes. Thank you all for rolling with our breakout surprise. So I hope that breakouts always, to me, feel like there's not enough time, but I hope that was a little more useful. Amanda, we can see that black square.
Sorry. Okay.
So we would love to just hear a little taste, maybe if there's like one theme that each of your, if each breakout group could share one idea that maybe got people the most excited. We'd love to hear that. And then, this is just the beginning of kind of what we're getting ready to build sort of a listening campaign, because we have over 520 or so members across California, but we don't know what they're most excited about. We don't know kind of what would inspire them to get more engaged with us. So this whole winter and early spring, we're going to be focusing on getting more feedback. And thank you to the facilitators again, and note takers. So we're going to look really carefully at the notes that were taken and reach out to each of you actually to do one-on-one meetings. But for now, if maybe, let's see, maybe Teresa, if you wouldn't mind sharing a key idea from your decarbonizing group, that would be awesome.
Sorry, I'm chewing.
Sorry.
Give me 1 minute.
Okay, let's go to Meghana. Do you want to share something that got people excited in activating organized medicine?
Yeah, so I think we had actually two themes, but I think they kind of complement each other, because one is kind of based on education of current physicians and really honing in on the fact that climate change is a health issue, and education through either some sort of grand CMA sponsored grand rounds. And the second thing that was kind of mentioned is also utilizing the advocacy and legislative capabilities of CMA and AMA, and really identifying a bill that we think would be impactful in climate change and using those resources to push that. And so I think those were like two big things and reasonable things that I think we could potentially accomplish that we discussed.
Awesome. Ashley, are you still there?
And yes, sorry.
Okay.
Teresa, were there any ideas in decarbonizing healthcare that people really resonated with?
Yeah, I mean, I think we spent quite a bit of time just with introductions and talking about our own systems and where they are within the spectrum of being carbon neutral. I think what we, what I got out of the discussion is that, you know, we have very different backgrounds, right? We have providers who are, you know, part owners of small practices or medium-sized practices, to providers that work within very large systems. We have people that are, you know, more administrative, have a more administrative role. And so I think what would be really helpful is to have a guide to help everyone kind of figure out, you know, how do you go through this process from the beginning to, like, you know, figuring out, okay, what are your problem areas where you should focus, to the end. Maybe your system is already doing some, you know, taking some actions, but how can you help augment those actions? And so I know that we're coming up with a toolkit, and I also know that there's a lot of information and protocols already available. So I guess if we can kind of organize that information for people, I think that would be really helpful.
That's a great idea. Yeah, kind of to get everybody on the same page, because there are different levels of leadership. Thank you. And then we'll go to Adrian, if you could share some highlights from the storytelling breakout.
Yeah, sure. So we reflected a little bit on, you know, what impact we've seen storytelling have or we haven't seen, because there was a variety of experiences in terms of how readily we each feel moved by narrative storytelling. So it was helpful to hear that range of perspectives. And then the other major thing we talked about was sort of exploring, like, what role would this have for CHN? And it basically seemed like it could take many, many different forms, whether it's in conversation with peers or presentations or media. And then one of the other points that was brought up near the end was the importance of engaging, like having the voices of younger generations be a part of the storytelling, because they will be so heavily impacted, and in many ways they grasp the severity of the situation. So including them in the storytelling.
Awesome. And then strategic partnerships. Ode, if you could share, that'd be great.
Hey, yeah, we also did spend a good amount of time with introductions at the beginning, but I think sort of really kind of my takeaway from our kind of short conversation is that there's just tremendous opportunity, I think, for Physician Voice to partner with groups, various groups. I think there's tremendous experience, and I think a lot of the members of CHN come in with a lot of previous experience leading campaigns or organizing various health voices, like Karen shared sort of her experience organizing California nurses around environmental equity issues. So a lot of opportunities to potentially partner across health professionals, and yeah, just, you know, a lot of sort of opportunities locally and sort of in the East Bay with just community environmental justice voices that just like really help Physician Voice. So I think kind of what I take away from a short kind of breakout is that there's tremendous opportunities, and just I think sort of like one-on-ones are sort of just continuing these conversations to really sort of figure out like where sort of the highest yield partnerships will lie, I think is probably the, yeah, kind of the work for kind of moving forward.
Awesome. Yeah, the interprofessional partnerships is as a beginning place too. Awesome. Well, thank you all. And again, this is just the beginning, but we're just trying to kind of socialize these ideas and start crowdsourcing input and levels of interest, because community organizing is all about team leadership. So those of you who joined the different rooms, we will be reaching out to you to invite doing one-on-one meetings with you and you know, seeing kind of how we can build teams around each of these, you know, as they evolve, each of these areas. So we can go to the next slide. And thank you all to the note takers too, because that will be our homework. So how new members join is we have a easy membership form. I think you probably all have this, but I'm just going to drop it in the chat. So if you're talking to a friend later today or tomorrow who wants to join, on our website, there's now a very prominent join us button, or you can just, so if they go to our website and click on the join us, that will help link new members in. And we welcome all healthcare professionals in California and students, if they're not affiliated with Med Students for Sustainable Future. And then our next meeting, so we are now all lunchtime Wednesday meetings, and our next one will be February 16th, around President's Day. And then we're just going to wrap up, and we're at time, but we're going to wrap up. We'd love to hear your thoughts on evaluation of how this meeting went, because this is a kind of a different model. So if you could put in the chat, we would really appreciate your feedback on what went well today for this hour packed with lots of information, what could have gone better, and then any key learnings or kind of insights that you had in the conversation. So if you put those in the chat, I'll do my best to take notes. And as always, you know, we'll be in touch. We usually do our newsletter that Amanda leads and does a great job with in the week ahead. And again, this is really just the beginning of engaging more with all of our members, and we really appreciate your time. We know time is the most precious thing, and things are pretty chaotic right now, so we appreciate your joining. Any
you
questions?
can also email if you need to jump off. If you have any thoughts at all, email either of us, or Ash, can you put our Climate Health Now email in the chat too? Okay.
Yeah.
Okay. Sorry for the black boxes.
That's okay. Does anybody want to share anything that went well today or could have gone better? Discuss.
We had trouble getting on, you know, all of us connecting.
Yeah.
So I think also having more time, you know, to meet in breakouts with some specific prompts would have helped. But for a lot of us, we were introducing ourselves and reintroducing ourselves. Some people do.
Okay.
So maybe next time.
Okay, got it. And then Mark, I saw about kind of speaking to how we used to have, you know, our action teams, what their vision is or how they're getting woven into our new strategic plan. And I see Mark, you put that too. Yeah, so in brief, you know, we are—
I'm gonna stop screen sharing actually, just for this.
Okay.